Hello, everybody, and welcome back again for the last session of the day. So glad you guys all stuck with us. I'm very excited that we got to do this virtually and we're starting to get back into the office. So just please note a few things, a little housekeeping items on this session is we're in the main stage. This is professional growth. This session will be recorded. So just note that your mics and cameras are turned off. If you do step away, that's fine. You don't need to communicate that in the chat, but I will be monitoring the chat. And if there's any questions or anything, Tracy, I'll send those over to her if we have that capacity. Otherwise, please help me introduce, give a warm welcome to our speaker, Ms. Tracy Hutchinson, and her presentation on verbal de-escalation. Tracy?
Good afternoon. Thank you, Anna. All right, so I do have a PowerPoint for visual learners that I'm going to pull up and follow along with. And didn't queue up where I wanted it to, so 2 seconds to get it to full screen, and here we go. So most of the information that I'm presenting today is pulled together from a variety of sources and adapted to fit more general service providers. So here's a list of some of the resources that I've used to bring this information together. So what we're going to talk about today is we're going to break this down into three areas. The first area, the first phase, we're really going to talk about how to avoid escalation in the first place. We really want to spend really a good bit of time there. And what are all the ways we can circumvent it? What are the cues that tell us it's coming? What are some of the things we can do to back away from a potentially escalating situation? And then we're going to talk about, okay, so we're in it. What is the anatomy of crisis development? And it's broken down into 4 stages. So we'll look at those stages kind of in slow motion and recognizing that sometimes we step into a crisis and it's already in full swing. But what I'm going to attach to those 4 areas in the anatomy of crisis development is which skills work best when and why. And I know this is a brief presentation. I'll pack in as much information as I can on that, but I'll also reference other resources to help round out more skills building. And then the last phase that we're going to really talk about is how to debrief from any escalated situation, and what some of the general rules are about how to debrief from something. So the big question I think that comes up when folks talk to me about de-escalation situations is there's a lot of finger pointing. How did it happen? When did it happen? How did it get started? Who's at fault? And so I want to spend just a minute speaking to who creates the crisis. So in general, I'm going to say the folks who create the crisis are the folks who are doing the least amount of self-care, usually. According to statistics that have been pulled for more than a decade, according to incident reports and documentation, police reports, etc. The person who creates the crisis most of the time is the person in the position of authority. So we really want to pay attention to how are we missing cues or how are we missing opportunities if we're in the position of authority for how to back away from or not create a crisis in the first place. So one of the initial things we really want to look at and consider is self-care. If you're not okay, if you are tired, if you are struggling, you're not in the best position for providing good care, safety, welfare, security for other folks because you're treading water yourself. So the first and most important thing we really want to look at is self-care. So this is I call this my F-bomb list, right? So I tend to think about this when others are F-bombing me in whatever way that comes across. It's usually emotionally charged, or I'm getting called names, or swear words are flying around. I think, oh, my anti-F-bomb list. How hydrated am I? Because when I'm dehydrated, my brain does not work as well. Neither does yours. We're human beings. We have some things in common. So how much water have I had? Am I hydrated? Because a pot of coffee does not do it. What kind of fuel do I have in my system? Have I eaten today? Have I gone more than 6 hours without any fuel? Is my blood sugar dropping? That's going to put you in a position of being at higher risk of being the person who's creating or escalating the situation. Do you have any fun in your life? Are you having any fun? Because if there's no fun and life is not fun, when you show up and you're in a situation that is a struggle, it takes a toll on how you respond and manage those situations. Where is your focus? Are you in the present? Are you here and now? If you're present, the buzzword these days is mindfulness. It's actually not a new concept. We used to call it here and now focus back in the 80s and 90s. But where is your focus? Are you here and now? Or is your mind on, you know what, I didn't take the meatloaf out of the freezer yet. I wonder what we're going to have for dinner. And not noticing what's happening in front of you, in front of your clients, in front of your coworkers. So where is your focus? And when you're home, when you're away from work, when you're with your friends, is your mind all tied up still on work? So be where you are, have your focus where your focus is. And we also need a filter. Is my filter engaged? The most important and valuable filter that I think service providers can have is that filter of what does it mean to be in the different stages of change. Because when someone's in a crisis, when somebody's escalating, it's usually about a request for change or a need for change, behavior, thought, etc. And so when I understand, when I recognize the stages of change, that when people don't realize, when a person doesn't realize that they are the thing or the person or the behavior or the thought form that needs to change, they're in a stage that we call pre-contemplation. Pre-contemplation. I have a lack of awareness. I don't even know it's me. And so I'm pointing my finger at everybody else. So when the finger is getting pointed at me, figuratively and directly, am I recognizing whether that finger is coming at me from a pre-contemplative place from that person, that they don't have awareness and recognition, or contemplation? I'm thinking I might have something to do with this situation. I'm thinking I might have something to do with the problem. That's a contemplative stage of change. So if I can just really look at and filter the difference between someone who has no awareness that they have a part in what's going on and those who have some awareness in a part of what's going on, I can filter a whole lot better. I can recognize that, oh, it isn't about me personally. They're pointing the finger because they don't want to or are unable right now to look at themselves or recognize their own part in things. So the filter becomes, I think, one of the more important things on this list. And then to have some faith. Have some faith in yourself. Have some faith in your team. Have some faith in the company. They hired you. They have faith in you. So confidence, faith in the situation. So when I'm thinking about self-care, these are some of the positionings that I want to think about every day. How am I setting myself in my day to day? With hydration, with fuel, with coming in with an attitude of life is good. Fun is accessible in my world. I can focus where I am. I can filter through information and that's coming at me and going out from me, and I can have some faith. So these are just sort of preparatory things or things to kind of do an overview of how am I doing in general. Again, when I'm in a position of good self-care, I'm in the best position for backing out of a situation. So we're going to We're going to spend a little bit of time on the anatomy of a crisis, and I'm going to weave into this information, not just skills, but also self-care as we go. So when a crisis is developing, one of the first identifiable things that's happening is anxiety. Now, for some folks, anxiety can go up from 0 to 60 in seconds. And for some, it's a slow burn. That anxiety's been just on a slow fuse. So my first question to you would be, do you recognize your own anxiety? Do you recognize when the anxiety is about you? It's coming from you, right? Or you're feeling anxiety, but it's not yours. It's in the room. Sometimes anxiety just hangs in the air. Sometimes anxiety is clearly coming off of someone. Look around, because the person who's the most anxious may not be the one that is having the most problems. It could be someone who is very triggered by someone else in the area that's struggling. So what do we want to do? First of all, you want to get your own anxiety in check. You want to pay attention to how grounded am I? As I look around the room and as I observe my environment, what else is going on, right? Can I be supportive, empathetic, non-judgmental, engaging with who and what is going on around me as I sort out where's this anxiety coming from and what can I do with it? If we don't have that awareness, one of the things that we need to really pay attention to, is that when a person is in any kind of pain or confusion, mental, emotional, spiritual, physical, financial, any kind of pain or confusion, chances are they're going to misinterpret most of what's going on, because their brain, their cognitive abilities are not as engaged in what's going on when their emotional system and their biochemistry is intruding on what's going on. Their pain and confusion are indicators to you that they're going to struggle with being able to understand and interpret what's going on accurately. And so one of the cues is, one of the things you could notice is that finger pointing. So I mentioned it earlier in pre-contemplation, there's a lot of finger pointing. And also when someone is in pain and confusion, not understanding things, misinterpreting things, they also frequently have a lot of finger pointing going on, and behavior begins to escalate. When that's happening, and what I mean about that most things are misinterpreted, is on your best day in terms of communications. And again, this has been measured over a long period of time and holds true. I think Gail Cotton published some of this information in one of her books. But there are a number of research articles you can access about communication accuracy. When information is only like the brief verbal or written, like a text, an email, really only between 7 and 16% of what you actually meant to convey got conveyed. The rest was either missing or misinterpreted, or because of the lack of information, the brevity of the message. Human beings have a tendency to fill in their own blanks. So in the absence of information, we tend to fill in our own blanks, and we tend to tag what we are thinking we're reading, what we think is being communicated, to our own filters, our own experiences. When communication is verbal, I think of Alexa when I think of this. You know, when you talk to Alexa or you talk to Siri, or when my GPS speaks to me, it's such a mechanical monotone, right? There are folks that are leaving brief messages, phone message that might say, Tracy, as soon as you get a chance, call me. And I can't really tell from their voice tone what's going on, but I can guess, and I usually guess wrong. So when there is verbal and there's voice tone, it depends on how much or how little voice tone, how much or how little articulation, how much is being said. At best, about 38% of what you're trying to convey when it's words only. So if you couldn't see me, if we drop down there. So if I just did that, right, you would not be able to, now I've lost myself. You would not be able to, oops, what have I done here? I'm going to drop down my screen share and bring my video back up. Oops. Can you help me out, Anna? I've lost my video and I did that myself.
Sure. Go back into just share screen. Do you have two screens or one?
There, I took down my screen share to find myself again.
Okay.
So thank you.
Go back.
I'm gonna go back and see, I was trying to do something really tricky and quick and it didn't work. So what I was trying to give an example of is if I drop my screen, if I went away and you only heard my voice, you begin to start guessing and interpreting what it is I'm saying because you can't see anything. You can't see my expressions. You only can hear the tone of my voice. So when you get a voice message, what it's lacking is the affect, the cues that we get from what someone else's face is telling us, as well as their voice tone and the words. When you have all of those things, you have words, you have voice tone, you have body language. At best, we still are only interpreting about 55% of what someone is saying or conveying accurately. In other words, they have a picture in their mind of exactly what they're trying to convey. And as they provide information to try to convey that, the receiver takes that information and tags it to their own experiences, tags it to their own interpretations and understandings of the words that are being spoken, the body language that's being presented. And so at best, we have, in terms of 100% accuracy, we're only at 55%. So when someone additionally is in mental, emotional, spiritual, physical, financial, pain or distress, it drops the numbers from there. And so a lot of escalation comes from being misheard, being misunderstood, or not feeling listened to and taken seriously. So one of the things we want to do, and I'm going to bring this up again later, is managing your expectations. We want to promote trust by modeling active listening. In other words, we want to be careful not to hijack other people's conversations. When folks are speaking, when folks are trying to convey things to us, we want to really listen. We want to listen with as much as we have, our visual, our auditory, our senses. But we're also conveying in how we are talking, what our tone is, what our interaction, how respectful we are being. We are promoting something, we're modeling something. So you want to manage your expectations and recognize what you are modeling. You want to promote action rather than reaction. In order to do that, you have to stop and listen. You have to give time to what is going on so that you can make choices rather than go into knee-jerk reactions. But when anxiety is present, remember, this is the area we're in, anxiety is building, it's really something that you have to make a conscious decision about. Is in the face of anxiety, can I listen well enough? Can I be present well enough to promote choice and action, not just within myself, but within the person in front of me? And can I employ my improved communication skills? And while all that's going on, I'm looking around my environment and considering what's my safety plan? What's my exit? What's my backup plan? Where's my help? So I want to be thinking about all of these things in terms of managing my expectations about what's happening and what's likely to be going down. When someone's anxiety is going up, when your anxiety is going up, it's kind of like a freight train. Sometimes it just spins out of control. It's really difficult to just stop the anxiety. Behaviors can be halted, but but it's really hard to stop that anxiety build, because the anxiety build has a lot to do with biochemistry, things that are going on in the body, in the system. And so anxiety can continue building even if the person is able to interrupt a particular behavior or a distressful pattern of behavior. It's also important to recognize that even though they were able to halt their behavior and their anxiety may be building, it doesn't mean it stopped what the problem is, and the behavior patterns or patterns of interaction are still right there in the doorway. So I want to talk a little bit about how real change happens, and that this is the phase, this early phase of anxiety is where talking with someone can still be very effective. Listening to someone can still be very effective. It's in a heightened state. Anxiety is up, behavior is on edge, triggers are often triggered. And so there's a heightened sense, but there's still an awful lot you can do in this phase to back away. And you need patience. It may take time. So I want to talk a little bit more about expectations, some of the things that may be going on. This is a very short list, and I'm going to verbally add a few more things. But when you are in awareness and assessing your expectations, some of the things that we tend to forget to include in what is going on here, and this is not just for the service provider, but also for the person seeking services or the clients that we are interacting with. What's going on in the brain? What's going on in their neural pathways? Has there been a concussion for this person, right? Are they on drugs? Are they high? Are they in withdrawal? What's going on in the brain? What's going on in the neural pathways? What's going on in the brain's ability to function well? Right? So that could be substances, that could be a head injury, that could be any number of things, dehydration, low blood sugar. That's why I mentioned them earlier, because it has an effect on the brain, the neural pathways, and how we think, act, and behave. Also, trauma is going on with a lot of folks, and we don't always recognize trauma, and we don't recognize necessarily the differences between trauma and PTSD and when someone's being hijacked by their trauma. So one of the speakers today really talked about trauma-informed care, and I'm sure that in that presentation there was mention of that sometimes when someone is in a trauma trigger that is PTSD, and is severe enough trigger, what it does is it hijacks that person out of the current moment. And it bypasses the frontal lobe, that part of the brain that sorts out, thinks about, figures, puzzles. What do I do? Right? So that part of the brain gets hijacked in some cases when PTSD has been triggered. And so the ability to talk to that person is gone. They're not listening. They're back in a moment of trauma, biochemically, insightfully, strategically. They are back in a trauma moment. Short of that kind of hijacking, sometimes when folks are PTSD or trauma triggered, what happens is their list of skills and strategies can collapse down to fight, flight, faint, freeze. Their list of strategies can collapse down to what is the most familiar survival technique at their ready, right? So there's varying degrees of that, and that requires a whole lot more information about trauma-informed, and recognizing capabilities and abilities in those different situations. But it should be something we have on our radar when we're looking at a situation that appears to be escalating, or look at ourselves. Are we in trigger, and are we escalating things? Because also biochemistry comes into play, and the biggest one, or the most familiar to folks, is adrenaline. In an average sized male with a healthy liver, it takes the body about 20 minutes to fully reabsorb adrenaline when you've had a big adrenaline squirt. So a big adrenaline squirt, let me describe that a little bit better. When you're in a moment of fight, flight, faint, freeze, one of the biochemistries that your body provides for you is adrenaline, so that you have that significant boost to be able to fight or run or faint or freeze, right? So I don't know if you recognize this. A lot of people are familiar with it, some are not, but adrenaline has some lasting effects. So once you have that moment, right? It's all it takes, and your adrenals, it's an organ, sits above your kidneys, gives a little squirt of adrenaline. It's in your system. That adrenaline can create feelings of what feels like even more anxiety, because sometimes it makes your heart race a little bit. Adrenaline can make your heart race a little faster, can make your breath go. Maybe you break out in a cold sweat. There are physiological responses to an adrenaline hit, right? And that often can add to what is perceived as anxiety, right? And now you're in a much more escalated situation. So if someone is able to talk with you, if they're willing to engage with you, just keep in mind, it takes roughly 20 minutes for that biochemistry to not be in so much play that they're on that raggedy edge of fight, flight, faint, freeze. Cellular memory is something that a lot of folks deal with. It's also in that trauma and trauma-informed category, but cellular memory is even a little bit more specific. It's your body's remembrance of being in certain situations, right? It's your body's remembrance of what it felt like to be in certain situations, including your pain response, right? So when folks get anxious, and they're anxious about something that's about to happen, and they have some history of something like this happening before, often the body will already trigger some of that cellular memory, and they have pain along with the anxiety. It's a remembered pain. It's a remembered response from the body, right? It's not a well thought out thing, that it's an occurrence. And then we have to also consider cultural differences, that what looks like anxiety to one is actually excitement and creativity to another. What looks like calm, cool, and collected to someone might mean to another person, my fuse is done and I'm about to pop. So there are cultural differences in how things are expressed, and with what kind of exuberance and energy, with what kind of body positioning, what kind of escalations that are not anxiety, and they're not escalation into crisis, but they're just escalated interactions, escalated energy, but not necessarily crisis. So I talked about adrenaline. I just want to give just a few moments to some of the other chemistry that is impacted when there is crisis. Some of it's long-term, some of it's short-term. So as well as adrenaline, which is responsible for that fight, flight, faint, freeze response, it also gives you a boost of glucose. It gives you a more rapid heartbeat. Cortisol is what chemistry the body is dealing with when you're under constant anxiety and stress. So those folks who have slow burns, whose anxiety has just been going on for a long time, and they're on a slow burn in terms of escalation, we tend to see an increase in cortisol in their overall biochemistry. And that is responsible for all the things that you see listed there. It gives us often a sense of weakness, that I'm not strong enough, and I don't feel very stable in my mood. And so anxiety, irritability, depression can look real different because it's more long-standing, right? So sometimes the person has a better sense of where their slow burn is at than you have. If it's a slow burn, you have the opportunity to talk. There's time. What's decreasing in the biochemistry is dopamine, serotonin, and oxytocin. These are feel-good chemistries. These are chemistries that help us manage. They help us manage anticipation, creativity, optimism, safety and security, the ability to really think, to plan ahead, to come up with what are some of the things that I normally do. So anxiety decreases those things. So it's not just they can't think. The biochemistry is not available there to think as well about what's about to happen, what am I doing, what are my choices, and what are my feelings of safety and security. So then why engage? That's an awful lot to consider. And if someone is escalating, why engage at all? Here's why. Because anxiety builds when someone feels that they are not listened to and they are not taken seriously. And so they're going to talk louder. They're going to talk more. They're going to get more animated, or they're going to get more insistent, whether that's out loud or internal, right? When there's anxiety and there's no engagement, or the engagement is telling them to settle down, right? It's not very effective engagement. So we're going to talk about what kinds of engagements are really helpful here for folks. So I want to talk about the power of paraphrasing and the power of silence. When folks escalate, one of the concerns folks often have, helpers often have about engaging is, I don't know what to say. I don't know how to fix this, right? And so I want to really affirm and really support the idea that you don't have to fix things, right? In that moment, even if it's your job to fix things, give a pause, take a beat, wait. So again, if the person is feeling like they are not listened to and not taken seriously, if you're shouting back commands, if you're telling them what to do and how to do, you're not demonstrating that you're listening to them and taking them seriously. But if you paraphrase someone, what I'm hearing you say is, you are so mad right now you could spit nails. What I'm hearing you say right now is you feel so backed into a corner that you just don't even know what you're going to do. What I'm hearing you say is, right now, I am the biggest barrier in your life, and you wish that I would, just disappear, right? So whatever it is they're trying to convey, a paraphrase just says, I hear you. It does not necessarily say, I agree with you. It says, I hear you. I hear you, and I take you seriously. Here's what I hear you saying. And then giving them an opportunity to absorb the fact that you heard them, right? So when you paraphrase someone, you really want to pause afterwards to give them a moment to absorb what you just said, which is basically, I heard you. Here is what you said. So if you've ever been in any of those, sort of typical human arguments, you know the ineffectiveness of just saying, I heard you, right? So let's just say in a regular old relationship, right? So you get into those moments where you say, I said, la, 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 la. And the other person says, oh, I know, I'm saying, la, 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 la. And then you say back, I know, I'm telling you, la, 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 la. That continues to happen and escalate because you didn't give the other half of, I know. I heard you. Here is what I heard you say. Is that what you're trying to let me know? Right? I don't have to agree with you. I just need to convey that I heard you. Here's what I heard. Am I accurate in what I'm hearing? When you know that, it takes the pressure off for feeling like you have to fix the situation, which often we can't fix the situation. But as I said, it drops anxiety significantly when a human being feels listened to and taken seriously. And so if they're spewing out what's going on and it's making sense, but it's escalated, right, in its energy, know when silence is important, right? As they are saying what's going on, are they, it's called catharsis. Are they cathartic? Are they getting out the energy? So the escalated voice tone and behavior and anxiety is reducing while they are talking. If that's occurring, be silent, let them talk. So paraphrasing and silence are two of your biggest tools in this really early, I don't know this person, but their behavior is escalating situation. Two biggest tools, paraphrasing and silence. When you speak, you want to talk in what's called strength-based statements. And we're going to talk more about power struggles in a bit, but you want to frame things around what is going well, what is being done correctly, what is well positioned right now, how they are managing, right? So you want to point to what they are doing and what they are managing rather than zeroing in on what they are not doing and what they are not managing. Because remember, what we're trying to do here is bring the anxiety down, right? So when a person hears back that what they're doing is effective and working, they're more likely to do more of it, right? So we want to use strength-based languaging when we are dealing with someone in that early escalated situation. For more information on that, and I'm just going to go through these things briefly. A lot of folks these days have been trained on basic MI, motivational interviewing. So this is William Miller from edition 3, motivational interviewing. Basic communication, that's asking someone to evoke change, to do something differently. You want to keep in mind a few of the basics. So William Miller speaks to staying in the spirit of motivation, right? If you want to motivate somebody to do something different, then convey in whatever way works and is ethical that you are in partnership with this person. They are not in this alone. You're right here, right? Even if you're in different positions, a power position and a non-power position, it's still a partnership because it takes both. You're just in different positions. So conveying that sense of partnership. We're in this together. We're going to get through this together. And conveying in how you are presenting, you have acceptance for that person. So really briefly, how Miller describes that acceptance is in the idea of absolute worth, that the person has worth, that they have autonomy, they have the right to make their own choices, autonomy, right? They have the right to not need you, right? Accurate empathy is not how I'm perceiving you. Accurate empathy is when I consider where you are looking at life from, I can have a different kind of empathy for what you're going through. So accurate empathy, that goes back to that filter we talked about in the F-bombs, right? I can filter the information a little more accurately because I'm trying to look through your lens to the best of my ability. What must life be like for you right now, given your circumstances, your culture, your positioning? I can have empathy, right? And it's going to be more accurate than what I think is good, bad, right, wrong, yes, no. And then I can give appropriate affirmations. Then I can speak to what are you doing well? I can use strength-based affirmations for how that person is managing their elevated anxiety. I want to have compassion. When I lose my compassion, it's called compassion fatigue. And again, the trauma-informed person that spoke earlier in this conference may have spoken to compassion in those terms. I'm going to say when you lose heart, when you lose the perspective that that's a human being in front of you, when you lose the perspective that that this person has their own struggles, right? That this person is in pain, confusion, fear, right? When we lose that, we stop treating them like humans. And we stop treating ourselves like humans when we have our own compassion fatigue. And that's often recognized by the lack of sensitivity we use when we're talking to others or about ourselves. So compassion fatigue tends to be, well, and I'm going to be extreme just to make the point quickly, because I know we don't have a lot of time today, but compassion fatigue is when I start thinking like, well, you know, there's a waste of skin, right? There's a waste of my time. Well, that person is never going to change, right? So that's compassion fatigue. You are recognizing nothing strength-based about that person, or if you do it about yourself, right? You're not recognizing anything strength-based about yourself. And so compassion is that ability to have heart and recognize yourself as a human and the people in front of you as humans who are trying and sometimes not doing well. Certainly the person escalating is not at their best, whether that's you or the clientele. They're not at their best. Have compassion for the struggle they are in right now. So that's very similar to accurate empathy, but it's really about you not losing heart. It's not about seeing through their lens. It's about don't lose heart for humanity. Don't lose the perspective that, you know, how many times is it going to take with this person? The answer is it's going to take as many times as it takes. That's compassion. Okay? And evocation. Learn how to evoke things, how to invite things rather than provoke or threaten. Right? And that has to do with that strength-based languaging. How do I invite you into a conversation? How do I invite from you information rather than threaten you to tell me or provoke you into making a change? So Miller calls this PACE, P-A-C-E, Partnership, Acceptance, Compassion, and Evocation. And one of his bylines is pace yourself. Change is a process, pace yourself, which really speaks to what I said earlier about patience. All therapists, general therapists, and communicators know the power of open questions and invitations to talk. So in that inviting someone into a conversation, which hopefully they are able to respond to if the anxiety is not too high, is open questions and invitations. So tell me more about what's going on. Say more about what's happening to you right now. Share with me a little bit about your frustration in this moment. Give me an example of what has you so distraught. Right? So I'm inviting you into conversation that says, I'm really trying to understand you. Open invitations and questions. Closed questions tend to feel like rapid fire. Are you here for an appointment? Have you been drinking? Do you have housing? Those are yes, no questions. And they don't foster engagement, right? What they often offer is what feels like an interrogation. And that often increases the anxiety because I don't know what you really want to know. Am I answering correctly? Am I answering fast enough? Right? Wait, I have all kinds of qualifiers to give in what I'm trying to tell you, and the anxiety goes up. So we're doing everything we can in this phase to bring the anxiety down, not just for the person, but also for ourselves, right? Affirmations, again, is that ability to say, you're doing this well. You know, I can see how much anxiety is going on with you, and you're still talking to me. You're still making sense. I'm still understanding. I'm still tracking you. Okay? I understand your dilemma. You're doing a good job of communicating to me why you are so upset. Right? You're managing to tell me all this without being aggressive with me. And so I really appreciate that. So those are affirmations. Help them recognize what they're doing well and do that with yourself. Recognize what you're doing well. Okay, so I'm being silent. I'm doing that well. I'm asking open questions and invitations. I'm doing that well. So internally, don't forget to give yourself some affirmations. Reflections, paraphrasing is something I already talked about, but reflections are the ability to say back to someone, here's what you sound like, here's what you look like, here's what I hear you saying. Here are the emotions I hear coming out of you. Okay? I can see that you're really scared. That's a reflection. I can see that you're really anxious about this situation. That's a reflection. What I'm hearing you say is that you're really not sure how this is going to go. That's a paraphrase. So those ways of phrasing things that say back to the person, not only do I hear you, but I can see you and I feel you. I got what's going on, and here's what I'm going to say back about it. When you reflect what you perceive about a person, make sure you pause afterwards and give them a moment to absorb what you just said and an opportunity to rebuttal or to affirm. Yes, that's really where I'm at. Because that's where the real connection comes. That's where the real sense of, I am listened to and taken seriously. That's where that comes from. That's where that comes in, is in the pause. Right? And a summary is the ability to summarize where you're at with a person, what's happening. Often summaries are used to kind of bring the person back to, and you're here for housing services, right? So I heard you talk about, your ex. I heard you talk about your kids. I heard you talk about financial concerns and the WIC program, and I heard, and all of that relates back to what you're here for, which is probation, or you're here for housing, or you're here for sorting out services. So that ability to summarize rather than discount all the things that they've been telling you, all the context that they've been sharing with you, to summarize back, here's all the things you're mentioning, here's what we do here. Here's what I can do for you right now. So that ability to keep track of all those things and bring it down to, what can I do for you right now? When you're targeting a certain behavior for change, also what we want to do is be listening when the person is sharing with us what their dilemma is, what's going on. What we want to be really listening for is the incongruency between three things. What are they doing? What's important to them? And what do they want? Right? What's your current behavior? What's your value systems? What's important to you? And what do you want? So when you feel like the person's anxiety is not so elevated that they can't interact with you, these are the kinds of things you want to find out. Right? What is getting in the way? What are the barriers? This is what's called developing discrepancies. And again, this is basic MI. If you have not yet taken an MI course, it would behoove you to either get the book or do a basic MI course, because a lot of the skills and strategies in basic MI are de-escalation skills. They work. So this is the last MI piece I'm going to put in here with this, and that is and this is really about your expectations for the person to do something differently in a sustained way, right? So their anxiety could be up because they're not able to sustain something, or their anxiety could be up because they don't know how to do something the first time. So when we are offering ideas, suggestions, or eliciting from them what strengths they have and how they might use those strengths in whatever particular situation they're in, we have to consider people don't really change. They don't make long-term change without a sincere desire, ability, reason, and need to make the change. All of those need to be present. So when you have an interaction with a client and they come back 2 days later or a week later and nothing's changed, and then you put some things in place and they come back again and nothing's changed, right? The piece that you're missing is exploring with them, what is their desire? Do they even have a desire to make a change? Do they have the ability, the skill sets, the finances, the support, the ability to make a change? Have they got a real reason to make a change? Because if you keep rescuing them, if you keep doing it for them, if they have someone who's codependent with them and doing things for them, taking them off the hot seat, they really don't have a reason to make a long-term change. And do they have a need? and it's their perceived need, not yours. So these are conversations you can have with the long-term clients about change, rather than you be frustrated with how come nothing's changing and you be the one that's escalating the anxiety, right? So it's about expectations. It's about recognizing, if I'm a service provider and I'm providing services and expecting change, I need to be realistic about how that's happening. Because if I'm unrealistic about it, I am the one who is likely to escalate the situation. And that goes back to what I said in the beginning. Who is often the person that escalates the situation? The staff. If they recognize and acknowledge their desire, ability, reasons, and needs to make a change, then you still have to work with them on commitment, the action that is needed, and then dipping their toe in and rehearsing and taking baby steps into that change. Change is hard, especially something that I've never done before or is not part of my cultural norms, or I haven't done sober ever in my life, right? So action, so commitment, action, and taking the steps also takes time. So be patient with your clients. There is movement that happens when you recognize what the process is that you are working through with clients, right? Now, that's on a slow burn. On a fast burn, someone whose anxiety just shoots up, boom, there it is, there's the escalation. Some of those skills may work, some of them they may not, right? Depends on how shut off that person is with their anxiety. So you're going to continue to demonstrate non-judgmentalness. You're going to continue to demonstrate that you can engage with this person in a trauma-informed and culturally sensitive way. That you can listen. You can listen well enough to hear what they're really trying to tell you. And by the way, more often than not, when someone is escalated and they are trying to tell you something, the real message underneath is typically one of three things, or a combination of these three. I'm afraid, I'm in pain, I hurt, I'm in pain, or I'm in a power struggle. So it would be useful for you in terms of filter. Remember when we talked about filters in that F-bomb list? It's not just the filter of pre-contemplative or contemplative. It's, can you filter what the real message is? Are they in pain? Are they afraid? Is this a power struggle? Right? And it may be any combination of those three things. But if you're listening, if you're paying attention, you're going to be able to recognize and then address appropriately, which way is it? What are we dealing with here? Pain, fear, or control issues? Okay. Don't forget the use of silence. And beyond that, slow things down. It's fair to talk slowly so that it sets a rhythm and a pace with the client to get them to slow down their rapid listening. Right? So that's what I just did. Just slowed down what I was saying, gave more pauses, and then that creates an opportunity for a breath to come out, right? To let go of your breath. For the client to let go of their breath, or the family that you're dealing with to just drop their breath down. Okay? So not just silence, but slow things down. As I said, paraphrasing, restating, clarifying, all very helpful tools. So once again, as you are managing your expectations, are you practicing these useful skills? Are your expectations realistic, especially when you are having a frustrating encounter or you're about to have an appointment with someone who frustrates you, right? Ask yourself before they come in, are my expectations of this family or this person, are they realistic? Did I consider things like biochemistry, culture, trauma? Did you learn from them? Are they learning from you? Are you applying any of what you learned in any of these courses that you're taking in this conference? And will you practice these skills, not just with clients? These are really awesome skills to practice really with anyone. They're good communication skills. If you're around where you have teenagers or tweens, preteens, they're a good audience to practice some of these skills on. All right. So again, we're trying to get the anxiety to come down. But if the anxiety is going up and everything you do is ineffective or is actually driving the anxiety up, the next stage, the next thing that's going to happen is the defensiveness is going to rise. And what you're looking for in that defensiveness, yep, they're going to be belligerent, they're going to call names, they might slam doors, they might swear at you. In their defensiveness, are they threatening? Or are they just getting loud? Are their threats real threats? So you want to really be cautious with this one. There's a real difference between, oh, I'm so mad I could just choke you, and I'm going to choke the shit out of you, right? So there's a seriousness of, here it comes. And, oh, I'm giving you a measurement of how frustrated I am, right? So in that communication, you really want to be able to sort out what's belligerence, what's being said that just says, ugh, stop it, you're not right, right? It's a win-lose defensiveness as opposed to a serious threat, right? If someone's defensiveness rises enough where their ability to make sense, their ability to what's the word I want? Their ability to be rational is dissipating. You don't have a lot of time here, right? This is kind of the last tail end of whether talking, engaging is going to be a benefit. But when their defensiveness gets to a place where they are irrational, now I don't mean that they have a different belief than you or that they're spouting a belief that you don't agree with. I'm saying irrational. When they are irrational, you better move to the next phase, which is get help, right? But as long as the rationality is there, you still have an opportunity to bring it down, to continue to approach things from a place of calm, from a place of reducing anxiety. But what you're going to start doing in this defensive phase is you're going to start setting some limits or start acknowledging that there are limits. So communication skills, keep them all in play, right? How you are communicating is going to come back at you. It's a mirror. So don't you escalate your voice. Don't you move to name calling or swearing or whatever. Keep your communication skills professional. Stay in control and be positive. Allow for an offer when you're setting limits, the most protective or the most positive scenarios first. I really appreciate that you're listening to me and considering what I'm saying so that we can continue this conversation without involving peace officers or without having to put handcuffs on you, take you to jail. Depends on, you know, what your service is. Peace officers might be able to say, you know, appreciate your continued engagement with me so I don't have to cuff you. Or if you are I'm dealing with a family in a home visit, you know, I really appreciate your ability to really listen to what's being offered to you and sort through what do you really need and what do you not need. right? So that if it's not important for me to be here, if I'm offering things that are not what you want, that you have the ability to really consider that and let me know, right? So I appreciate your communication with me. So those affirmations, those moments of positivity when you're setting limits can be very powerful. So be patient, recognize what's going on, listen, then take action. When folks are in that rational, irrational, sort of window, you want to stay aware that they are allowed to ask questions. It's fair for them to be curious. What's going to happen? What happens next? How does that look? To clarify what's going to go on. What are you saying? Right? What do you mean by that? It's fair for them to consider. It's fair for them to say, well, what if? What if I do this? What if I do that? What if you do this? What if I do that? And even if it's said with attitude, they're still curiosity questions. They're rational. Answer them, but answer them without attitude. Answer them from the most solid and neutral place that you know how. They're allowed to get contextual information. And they're allowed to have cultural differences and to express those and to be curious about yours and yours of your agency. And they have impressions of you and your agency that are cultural. Give them time to sort through those. Give them opportunity to sort through those if doing that brings the anxiety and the defensiveness down. But if you're responding in a way that the defensiveness is going up, consider your responses. There are times when it doesn't matter what you say or what you do. If you say nothing, right, that people's anxiety is going to grow and their defensiveness is going to grow. I just want to speak to this example down here. The little girl's afraid to run home because of the man in the mask. If we were doing a live communication, I would say, I'm the little girl and I'm afraid to run home. And you would ask me a bunch of questions. And typically what happens is by the time you ask me questions, you're ready to call social services, call the cops, and really the man in the mask is the first baseman or the catcher, and he's yelling at me to run home and I'm playing baseball, right? So if you didn't take the time to ask questions or consider what's going on, but you just took one thing that a person said and you acted on it, often you're wrong. And so again, curiosity, clarification, context, consideration, and culture should be things that we should be looking at and considering. It is a power struggle when the communication is going like this. It's communication issues, right? Learn how to say it better or paraphrase when it feels like the communication is going like this. So this is frustration, this is anger. So power struggle feels like, do it my way, right? Miscommunication is frustrating, right? So we want to recognize that escalates situations. Watch your tone, watch your volume, watch your cadence. I did not say you were stupid. I didn't 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 say you were stupid, right? Same sentence, your volume, your cadence, your rhythm, your tone changes that sentence with every time you change the emphasis, the tone of what you're saying. So recognize when you pull up that parental tone. Recognize when you pull up the frustrated tone. Pay attention to how you're saying what you're saying, right? So here's some skills at this point for irrational, right? Be simple and clear, be reasonable, and if you're going to set limits, make sure they're enforceable. Don't fight, don't give up, don't give in. Right? You can use broken record technique, right? Keep repeating the same thing, but from a neutral position. You can limit or table further discussion. That we're going to talk about tomorrow, or that we're going to talk about in 20 minutes. But right now, here's where we are. So when you're setting limits, make sure they are simple and clear, reasonable and enforceable. And again, always try to set the positive, what you're offering as a plus first. And second, what they will lose or what will be curtailed or removed. Folks have the inalienable right to make choices. So when we set limits, we want to keep that in mind. Right? They have the right to say no. If the defensiveness goes up so high that the irrationality is there, get help. Acting out is going to happen. There is a point of no return in escalation that you have to recognize when you hit it, or if you walk into a situation and it's already there, the fuse has been lit, it's gone, the irrationality is gone. You want to back up, you want to look at safety and containment. Where is your help? Take all threats at that point seriously because the rationality is gone. So where is your help? This is where it comes into play and it's important that you have a safety plan, that you know where your help is, and that you stay in control. It's a scary moment, right? So you need to recognize your own triggers. Where's your help? It's within your realm of possibilities to control your environment in certain ways. In other words, do not stand between a acting out person and the door, right? Make sure you both have even access to the door. Open the door, right? If you are the person who's been called in to help in an escalating situation, don't come in all anxious and escalated yourself. Come in and sometimes it controls the environment just to see that there are at least two people who are present and going to manage the situation. Right? Sometimes it's a uniform that either triggers more acting out or can settle someone down just because there is a witness and someone who exemplifies boundaries and an ability to enforce limits. Right? So look at what you can control in your environment. Move items, move yourself. Right? Open doors. Stand behind chairs so that there's something between you and the person who's acting out. And punching range. You want to stay out of punching range. You want to make sure there's at least 6 feet. We've been measuring that for a year now, right? 6 feet. Get 6 feet away from that person because they'll have to lunge at you in order to assault you. And that gives you that extra half a second to respond. So control your environment, control yourself. And get on eye level with them. If they are sitting down, then you sit down. If they are standing up, then you stand up. Be at eye level. Be careful if you crouch down. I'm over 60. If I crouch down on my knees or crouch down in a squat position to be at eye level with someone, I'm very vulnerable because it's going to take me a little bit to get up, right? So you want to make sure you don't put yourself in a position that leaves you physically vulnerable. Pull a chair over and sit on the edge of a chair, but be ready to move out of that. Sit on the edge of the chair, be ready to move as needed. So you want to have some exit strategies and exit maneuvers available to yourself for how do they get out, how do you get out. Keep in mind that crisis services is always available. And so know your resources, not just your in-house resources, but your community resources. So mobile crisis can come if there's a mental health issue or a consideration of danger of self or others in those escalated situations. Don't forget that this is one of the resources to call for help. So let's review a few things quickly. I know we're running short on time, I think. Whoops. Did I go too many? There we go. You want to stay calm. Isolate the situation as needed and as able, right? You can ask people to leave the area if things are looking like they're escalating and it's going to act out. You can ask other family members to leave the room. You want to remove audience, right? But don't isolate yourself so much that you don't have help, right? But remove your audiences, remove those people who are trying to intervene and over creating more chaos in the situation. Do enforce limits. Listen. Be aware of nonverbals. They're often telling you more than the words are telling you. And be consistent. Right? Try not to overreact. Try not to get in a power struggle. Do not make false promises. Do not threaten. And be wise about your language. Using jargon can be more disconcerting for folks. They can get concerned, afraid, or feel like you're talking down to them when you're using jargon they don't understand. So in summary, you may not be able to control what's happening or the precipitating factors or the person's acting out, but you can control yourself, and you have some limitations, but ability to control your environment. And then you also have the ability to control yourself afterwards. Keep your own anxiety down, keep your own awareness down, and have a place where you can let go of your own adrenaline as you're going through this process with folks. Because there has to be a period of time of tension reduction. Okay? So tension reduction is that time frame where it's important that the person have time to breathe. Remember, I said 20 minutes for adrenaline to be reabsorbed enough and for the biochemistry to really start to really come back to a baseline. And that's without the influence of street drugs, alcohol, or some other medications, some other situations you want to keep in mind that those can also change the timing. Trauma response, right, can all change the timing of what's it going to take, how much time will it take for the tension to come back down. So it's a time thing. You want to keep your finger on the pulse of that decreased energy, because this is the most dangerous time for re-escalation. So you want to consider, what do you need to do to let go of this energy? I don't know about you, but I get really annoyed when people tell me to breathe, right? So be wise in what you tell people to do. You invite, you don't tell. What's an appropriate release for you? Do you want to go for a walk with me? Is it safe? Are there contained grounds? Is it safe to go for a walk with them? Is there a place where they can vent and swear and pound on a pillow? And does doing those things release, or does doing those things re-escalate? So there needs to be an opportunity for that dissipation of energy, right? So the acting out will sometimes increase and sometimes start to dissipate that tension. You need to allow time for the rest of the tension to come down. And you're really, the finger on the pulse is really making sure that you allow time to collect thoughts and regain control before you go into debriefing. So it takes time. You want to re-engage about anything except this incident, right? This is not the time to review what happened. This is a time to regain confidence, regain connection, regain engagement, do some self-care. Let's go get some water. Let's go get some tea. Let's sit, let's walk, right? Let's get a little snack, right? So remember, hydration, fuel, movement, right? Because again, I'm going to say this tension reduction is the most vulnerable phase for recreating or creating another trigger, right? Debriefing is a whole nother category. Debriefing, did I go too many slides? Let's see. Nope, I didn't. I got them out of order there. That should be the next slide. And then this. So in debriefing, we want to provide support, encouragement to all involved. We want to express trust and confidence, and we want to put closure on an incident. The purpose of debriefing is not to figure out who's to blame. The purpose of debriefing is an opportunity to really look at what happened. How did it happen? Are our policies that we have in place adequate? Is our safety plan that we have in place adequate? Is our help and our way to call for help adequate, right? What is going on? What happened? Not who's right, who's wrong, right? Everyone's going to have a different perspective of what happened. because they are under the influence of adrenaline themselves. We're not after making sure all the stories match. We're after looking at where was your concern? How did you perceive it? What were you lacking? What are you needing? Right? And how do we do this going forward? So it's about making agreements, not having fights. You don't want to start a power struggle over debriefing. We're really looking for patterns. If there's a pattern of behavior with a particular worker or a particular family or a particular person receiving services, that's important to recognize, because then we work with the pattern to set things in motion to circumvent or reduce escalating situations. But that means we also have to notice our own patterns, our own triggers. We really want to look at alternatives, resources. What interventions were the most helpful? What worked, what didn't? I'm just giving the slides a minute to catch up to the things that I've said, because, you know, there are visual learners. There are folks that are reading the slides more than they're listening to me, and there are people listening to me more than they're reading the slides. And there are people who are doing both, and people are doing neither. So just giving you a minute to catch up on that. So in summary, you know, in any crisis, there's only 3 outcomes. Things get better, things get worse, or things stay the same. I am going to speak just a second to things get worse. Sometimes it looks like things got better, but what we did was we taught them how to put it more underground or covert, right? It didn't get better, they got sneakier. Right? So in your assessment or evaluation of what happened, what do we need to do? Do we need to adjust a service plan? Do we need to adjust a perspective? Do we need to adjust where we meet with this person or with this family? Do we need to have help on the standby? Just be aware that sometimes we teach them how to do things more covertly, and we think it's better, but it really isn't. Oops. So I'm back to the idea of caring for oneself is the first step in providing the best safety, care, and welfare for others. If you're okay, you have something to offer. If you are not okay, you are offering more escalation. You're offering more chaos. You're offering more of what we're actually trying to bring down and bring back, right? So caring for yourself, and back to where we started, self-care, self-care, self-care. So I want to put this slide back up and say, I've referred to this several times in this quick hour and a half that we've had together. Really consider your self-care and how you manage your self-care on a daily basis. Because when things escalate, when you're in crisis, and these things are not in place for you, these things are not part of your daily living, that crisis will be worse. So part of de-escalation starts with just your daily personal care habits, your daily ability to recognize that you are putting yourself first in ways that matter, so that you can show up at work with clients in situations, and when needed, put them first, because you're taken care of. But when you're not taking care of yourself, and there's a crisis, and you have to put whatever is yours aside and take care of others, it's very, very volatile. It's difficult, right? It's not very stable. One of the things that I consider when I'm really looking at, I'm just going to back up for a second. One of the things that I really consider when I'm looking at situations is how invested or how over-invested am I in that person's situation? Am I rescuing or am I helping? Do I know how to be of service correctly? So, which means I have good boundaries. I'm recognizing where my limitations are, and that what I want for the person, what I wish for the person, what I really sometimes want to just put down their throat is not necessarily in their best interest. And it's over investment, it's poor boundaries. So one of the things I tell myself, or there's a phrase that I use, and that is, what is the most benevolent outcome for all in this situation? Or let me say it a different way. What is the best win-win situation we can come up with here? So when you look at and you consider win-win, when you come from the perspective of how do we get to a win-win, and even if you don't know, offer that question. What would a win-win look like? Whether that's in a staff meeting, a planning meeting, or an actual interaction with another staff, with a client, with a family, what is the best win-win scenario here? What is the most benevolent outcome? That mind frame will help you not be the person escalating the situation. So we want to shift those statistics from most of the time it's the staff or the person in charge escalating the situation. We want to shift those statistics. We do not want to be the cause of escalating situations. And once again, I'm going to say it's not because we're trying to be bad or we are difficult people, or it's because when anxiety comes up, fear sometimes follows. And if we don't have a plan, if we don't have boundaries, if we don't know where our help is, if we don't have some ideas on how to handle things, it's scarier. And your own anxiety is going to go up, and you're going to grasp at straws for what to do and how to do it. And that's how you're going to contribute to the escalating situations. So self-care and pre-plan. Have support from your staff. So Anna, how am I doing with time? Have we got some time for question and answers? If not, I'm going to say we're at the end of the day.
Hi there, guys. Sorry, Anna had to step away for a minute. We have about 5 or so minutes. So if we do have any questions, if you guys want to post them in chat now, and I can let Tracy know if I'm seeing anything come through. I see wonderful comments. They love what you're sharing, Tracy. So great job.
All right, thank you. And thank you for the opportunity to present today. And if there are any questions that folks have or some follow-up that they have, please feel free to contact me either through this company or you can visit my website or email. And I just really appreciate the opportunity to provide this information. And Anna, thank you so much for moderating. And I guess that's a wrap.
Wonderful. Tracy, we did have one question, and I was going to follow up with Ann and those, but they did ask, will your presentation be shareable? Is it okay to share what you shared today, or can they access that in documents?
The PowerPoint, are you talking about?
Yes. Yeah, the PowerPoint.
If y'all will get in touch with me on how to get that over to you, yes,
Okay.
or you can contact me directly and I can email it to them.
Perfect. Thanks, Tracy.
Thank you.
All right. It looks like everyone is saying thank you, so I'm not seeing any other questions today.
All right. Okay. Thanks so much, and everyone have a great rest of your day. Do good self-care. You got time.
All right. Thank you again, Tracy. Wow. So informative, so relevant to communicating on a daily basis in any scenario, family, client, work, or home, to slow down and pace ourselves. Excellent and all helpful tools to practice and add to our toolbox. So thank you, thank you, thank you.